primary purpose of the iMobile here in District 33S is actually twofold. First and foremost, it's a way to help the public. We use this as a screening tool. It's not a diagnostic tool, it's a screening tool to let people know if people come in and are screened, perhaps they have vision problems, didn't know it. We have a tester for glaucoma, which most people don't go out and get screened for. Hearing problems, diabetes testing. That's the main goal. That's the main focus of the iMobile. Second, it's a great PR piece, PR tool for the Lions of District 33S. It's a giant billboard with lions plastered all over it. People see that, people get to see the lions, they come in, they're screened. It's a wonderful way to get new members. The iMobile has been around, well, I've been a Lion for 30 years, and it was around shortly before that. It was, the first iMobile was purchased back in the 1970s, and I believe that was the original purpose too. Back at the beginning, all we had was the acuity screening. And the clubs would have firefighters or nurses come in and do blood pressure screenings. That was the first two things. We also have a hearing booth. One of the big programs in our district is the Hearing Foundation. We are into hearing also. So we have a hearing booth that tests people's hearing. If we find that they can't hear too well, we can recommend that they go see an audiologist. We still do blood pressure screening, one of the original things. One of the new things we've gotten into is diabetes testing. We have a professional come in, be it an LPN or an RN, or someone that can take blood and test the blood for sugar. And I know of 3 people that I've been involved with that found out they had diabetes just by coming through the iMobile. Did not know they had it before. 40 to 50% of our clubs use the iMobile, and not all of them use it for testing either. Many of them just use it to have it in a parade. Getting back to that giant billboard to advertise Lions. We'd like to get more clubs using it as a diagnostic screening tool. Probably 35% of the clubs use it as such, and we now have 57 clubs in the district, only 25 using it. We'd like to get those other clubs to use it. And it is really simple to use. People are just afraid of doing something new. We have training sessions here. We are sitting in the parking lot in Lakeville as we speak. They have training sessions once a month, sometimes once every 2 months, where the club can get in touch with the iMobile committee, and they'll schedule a time where they can come in and get checked out on the various things we have, diagnostic tools we have in the iMobile. There is also driver training, because naturally you have to get the iMobile to where you're doing your screening. We like to get at least 1 or 2 people from the individual clubs checked out on how to drive it. Basically, it's a 35-foot motorhome. So if someone knows how to drive truck, or has their own motorhome, it's very, very easy to drive. There's 2 separate trainings. Again, the driver training is one where you get certified by one of our trainers from the iMobile committee. That is separate. The other training is training on the equipment. The iMobile doesn't leave the garage. They just come in, and we train people how to use the different types of equipment. I just want to show the members of District 33S some of the different equipment that we have in the iMobile, and really is simple to use. This unit is probably the most high-tech one we have, and it really isn't that difficult. It's called a tonometer, and it measures the pressure in the eye for the disease called glaucoma. And very simply, my lovely assistant Judith We just have the person will put their forehead on one side, and then on the inside, they look at a little green dot. And when they have that little green dot in focus, they're just a button we press here, and the machine does the rest of the work. The machine focuses in on the center of the eye, and then a little puff hits the eyeball. And the resistance to that puff of air shows what the pressure is inside the eye. And it's that pressure that determines if the person has glaucoma. So it's very simple. This is another setup we have. It's for vision acuity, and you have some other film on that. But basically, what it is, the person we're screening will look inside this machine, and all they're looking at is your basic eye chart that you would see in any doctor's office, and by which line they can read, we can tell if they have 20/20 vision or 2100 vision. We test for farsightedness and nearsightedness. And if they think they're seeing fine, and we only test out that they can only see, their vision is only 10/100, we recommend, I think it's time maybe you should go see an eye doctor. So again, it's just for screening. We don't tell them they have bad eyesight or anything else. We just suggest to them. And we really don't suggest who they go see, just that they should go see an eye doctor. What you're seeing now is the hearing portion of our iMobile for screening. You've seen Paul inside the hearing booth. He's just put the cans, the earphones on, and what happens now, he's holding up a little apparatus where he can press a button. It's all automatic. We just press one button, and how this works, he'll hear a series of pitches, low to high, at a series of different decibels. And what happens, they'll do a low sound at a very low level of volume. And if the person cannot hear that, they'll go up and it'll do it a little bit louder and a little bit louder in increments until the person can hear it and presses the button. Then they'll go up to a higher pitched sound, and they'll do the process all over again. They'll start at a certain low level and work their way up. And that's how the test is done. It tests 5 or 6 different levels of pitch at different volume levels. And by what the person can hear, by their response, that's how we get a readout of actually what their hearing is. And if they cannot hear certain pitches at a certain rate, we have a chart that shows when we should recommend that they go get their hearing tested by a professional. So it's very simple. It's something you might have done in school in earlier days. And again, it doesn't diagnose anything. It just screens. And if the different levels that come out, if our chart shows that you should be hearing better than that, we recommend that you go to an audiologist, either at Morton Hospital or a private doctor. And that's as simple as that goes. Again, all these different things are screening. We do not diagnose anything. We're not liable, for giving a wrong diagnosis, because we're not diagnosing. We're just recommending. We're just screening. That's how that works. And once the test is over, we get a printout of it, of this little printer, and we test, and we look at that against this chart, and it shows if you have moderate hearing loss, severe hearing loss, slight to mild hearing loss, and we give that information to the person who has been screened, and it's up to them to take it from there. I want to talk a little bit about funding for the iMobile. We have an organization in Lions Clubs International called the Lions Clubs International Foundation. we were able to get a grant from them each time to purchase the last Imobile and this Imobile. This one, I think, ran us $110,000. We were able to get half that money from LCIF. We raised half of it here in district. We applied for a grant. They provide the rest of the funds. We are looking to do that, not right now, but in the next 5 or 6 years. I'm sure we'll be in need of a different unit. There are other things we can put in here that we just don't have room for right now. We have a camera set up that can take pictures of the back of the eye and can be transmitted to some of the eye research facilities, and they can read those pictures, but we don't have any place to put it. As you know now, with the newer motorhomes, there are slide outs that make things much more roomy. Some of the other Imobiles have units that have slide outs. They got started later than we did in getting Imobiles. But some of them are, very spacious. District A's Imobile, District A is in the Worcester area, central part of the state. They have a motorhome that is 40-foot long. Now, we can't get one that long because it won't fit in the garage. So we have I think it's about 35 feet. And that's about as big as we can get. But it doesn't mean we can't get the ones with the slide outs, to provide more room like that. So you're able to have testing stations on both sides of the aisle. So looking to do that.